Foot X-ray anatomy, normal foot X-ray. Normal foot X-ray. A foot X-ray is a basic investigation for orthopedic problems and should be done on a child if they are about to start walking or when the patient is experiencing pain. The images can be in two different views, dorsal plantar or medial lateral, and the feet should be positioned weight-bearing. It is important to have both views for proper diagnosis. A child should always remain still during the examination. And if they are too small, parents should explain that they should be seated or lying down. An oblique X-ray is best for viewing the phalanges and interphalangeal joints. Normal foot X-ray, the base of the fifth metatarsal should be checked and the tarsum to tarsal alignment should be checked. The calcaneum and sesamoid bones of the first toe are also visible on a normal foot X-ray. It is also important to examine the medial and lateral tarsals. A video of a foot X-ray is also useful for visualizing the phalanges and interphalangeal joints. The fifth metatarsal should be analyzed for correct alignment, as should the lateral tarsals. The calcaneum should also be checked to ensure it is positioned correctly. If any of these issues are present, the doctor should schedule another test to check the alignment of the metatarsals. A video of a normal foot X-ray is also helpful in determining any underlying issues. The oblique view is particularly useful for visualizing the medial elements and the articulation of the Lisfranc joint. The interphalangeal joints are obstructive on the antero-posterior foot X-ray, as are the lateral tarsals. The calcaneum should be in proper alignment. An oblique X-rays help to understand the position of the phalanges. Normal foot X-ray, the oblique X-ray can better visualize the interphalangeal joints. The lateral tarsals are positioned in a correct position and the sesamoid bones in the first toe are well aligned. During a foot X-ray, a physician can see whether the foot is properly aligned or not. The oblique X-ray is a great tool to see the medial cuneiforms and the interphalangeal joint. The lateral tarsals are positioned in a straight line, and the interphalangeal joints are not obscured. The lateral tarsals are the calcaneum and sesamoid bones of the first toe. The oblique X-rays allow a physician to better see the interphalangeal joints. The fifth metatarsal is well aligned, and the base of the fifth metatarsal should be checked. The medial cuneiforms and lateral talons are also important to understand. If they are out of alignment, the lateral tars should be analyzed. A normal foot X-ray is an important tool for understanding the foot's anatomy. Normal foot X-ray, it can help physicians identify abnormalities that affect the feet. Aside from the oblique view, the lateral talons are another useful X-ray view. The calcaneum is important for understanding the position of the bones of the foot. They should be aligned in the medial plane and be straightened. An oblique X-ray allows for a better understanding of the interphalangeal joint. The fifth metatarsal and the base of the fourth metatarsal are important to look at. The calcaneum and the sesamoid bones of the first toe are also visible. A normal oblique foot X-ray reveals the bones of the foot. But it is important to remember that the calcaneum is the most complex of all structures in the foot. In addition to common X-ray conditions, a foot X-ray can help diagnose other health issues. It can be used to detect broken bones, dislocated joints, and to evaluate the healing process. It can also help determine whether surgery is needed to correct a problem. It can also detect tumors, cysts, and infections in the bones. An X-ray can provide doctors with crucial information about a child's health and how to prevent them. The X-ray beam is not parallel to the foot and cannot show foot deformities. This means that the fourth metatarsal should align with the medial border of the cuboid. A weight-bearing foot X-ray will not reveal diastasis of the joint. An X-ray of the foot is not useful for diagnosing other health issues. Moreover, it can be misleading to diagnose a deformed foot. Normal foot X-ray, normal foot X-ray, normal foot X-ray.